The fast track is part of our emergency department, but it's the part of our emergency department that's set aside to take care of the more routine things that aren't major illnesses. The conditions that you would think about typically going to an urgent care for, things like cuts, abrasions, sprains, strains, muscular aches and pains, and stomach flu. Those are the common types of things that we care for in the fast track. And it's an area where patients who don't need a lot of testing will go, and it's generally a fast place to receive care. When patients come in with chest pain, we often don't know if they're having a heart attack right away or not. And so we'll do a heart tracing or an EKG to see if we're seeing signs of a heart attack. Although the important thing is that many people who are having a heart attack will have a normal EKG to start. And so it'll take us a series of tests over 6 to 8 hours to know if someone's having a heart attack or not. So because people don't want to stay in the emergency department for that period of time, we have developed an area called the Clinical Decision Unit, and that's where we'll do these series of tests. It's a quieter environment for patients, but it's still part of the emergency department, and if we do detect that someone's having a heart attack, we have all the resources to be able to treat them appropriately. Once we know they're not having a heart attack, then we can do more complex testing to see why they're having their symptoms. And examples of that might be an MRI scan of the heart, or an ultrasound of the heart, or more of a routine stress test, or even a CAT scan. And so that type of testing can take time, but in our clinical decision unit, we can generally get that testing done relatively quickly and then help the patient understand why they're having their symptoms. Here in our emergency department, we use something called TeamBased Care. And so we have teams that consist of a supervising doctor like myself, and then doctors in training, so doctors who've actually completed their medical school and now are training to become the next generation of emergency specialists. And also on the team we have physician assistants and nurse practitioners, along with nurses, technicians, and other staff that help provide care to a group of patients. In these teams, what commonly happens is one of our physician's assistants or one of our doctors in training will first assess the patient, and then the patient will generally be assessed by or seen by one of our supervising doctors as well. After that, there will be a discussion about what types of testing, what types of treatment are appropriate for the patient to make sure that we're delivering excellent care. We provide the highest level of care to our patients, but at the same time, we are teaching our doctors to provide that highest level of care as well. So not only does that improve the health of patients here in Winston-Salem, but actually improves the health of everyone in the United States where our graduates go and provide the care that we've taught them to provide.